Now, next we have dental caries indices. So first one is DMFT index, which is given by Henry Clean, Carolyn Palmer in the year 1938. And small town Hangerston, grade school children, eastern sections of US, first time यहीं पे हुआ था और सब्जेक्ट थे हमारे 3000. Attended municipal elementary schools of 1 to 8 grade school children. जो इंस्ट्रूमेंट यूज हुए थे वो प्लेन मिरर, फाइन पिन पॉइंट पिगटेल एक्सप्लोरर under favorable lighting conditions. So the DMFT means decade missing and fill teeth index, and it is a tool used to measure oral health. And it's a common tool in dental epidemiology and is used to assess dental caries as well as the treatment needs. So in recordings, we use unadapted extraction permanent teeth were noted, bitten fisher caries, explorer caught and on inspections were not considered, definitely caries were noted and not counted as caries. Teeth caries show small cavities. Extent of caries is measured in terms of tooth surface involved. One surface to other separately as carious surface. Filled teeth noted. Full crowns, 5 filled surfaces. Findings, we have number and kind of teeth present, absent in an individual when examined. Past and present caries. Present caries, actual caries present at the time of examination. Past caries filled missing because of caries. DMF, complete caries experience, obtained rarely from permanent teeth, since missing teeth is in children indicates caries, severe caries, and the total caries experience in permanent teeth is DMF. These are the principles of recording of DMF. So, one thing, remember that this is for permanent teeth. The uppercase DMFT means it is for permanent teeth. So that's why all the permanent teeth were examined, excluding all primary teeth and third molars, because when lowercase DMFT is used, it will for primary teeth. So a tooth is considered to be erupted when the occlusal surfaces of or incisal edge is exposed or can be exposed by manually reflecting the overlying gingival tissue. A teeth is considered to be present even if the crown has been destroyed, leaving only the roots. No tooth to be counted more than once. It is either decayed, missing, filled, or sound. Decayed, missing, and filled teeth should be recorded separately. Care must be taken to record as missing only those which have been lost due to caries. Also include those teeth which are badly decayed and are indicated for extraction. A tooth may have several restorations, but it is counted as one. So, what are the uses of DMFT index? First, we understand it is used to monitor the oral health interventions and to develop the policies and programs related to oral health, to reflect oral health and dental health of the community. So, what are the limitations of DMFT index? It does not provide information about previous dental care. It does not provide information about the severity of caries attack, and it does not provide information about the indicated treatment. So these all are the tooth. अगर डिकेड है तो यहाँ डी लिखेंगे, मिसिंग है तो एम लिखेंगे, फिल्ड है तो यहाँ फिल्ड लिखेंगे. सो जैसे जैसे सारे हैं यहाँ पे हमने देखा, यहाँ 7 तक है, यहाँ भी और यहाँ भी 7 तक है. हमने 8 को इंक्लूड किसी में भी नहीं किया चारों आर्च में. सो इसमें सारी चीज हम मेंशन करेंगे. और डिकेड टीथ कितने थे वो यहाँ लिखेंगे, मिसिंग टीथ कितने थे वो लिखेंगे, फिल टीथ कितने थे वो लिखेंगे. अगर 3 डिकेड है, 3 मिसिंग है, 3 फिल्ड है तो यहाँ हो जाएगा 9. हमारा डीएमएफटी स्कोर 9 होगा. सो कंपोनेंट डी के बारे में यहाँ लिखा है. अच्छा, it describes the decayed teeth which include carious tooth. The explorer should fall into the carious lesion and not just in a deep groove. Filled tooth with recurrent decay, only the roots are left. Defective fillings with caries. Temporary fillings, filled tooth surface with caries on other surface. In M component, it indicates number of missing teeth due to decay. The teeth missing not due to caries are excluded. These are extracted due to reasons other than caries, due to orthodontic treatment like impaction periodontal disease, unerupted teeth, congenital missing teeth, avulsed teeth due to trauma or accident. In the field component, we have it indicates the number of caries permanent teeth that have been restored. Teeth are considered filled when one or more permanent restorations are present and there is no secondary recurrent caries or other area of the tooth with primary caries. A tooth may have several fillings, but it is counted as one. Tooth restored for reason other than dental caries should be excluded, which include restorations of fractured, traumatized teeth, hypoplastic teeth restored for aesthetics, bridge abutments, fissure sealants, preventive infiltrations. So, how we calculate DMFT index? Such a one more important thing we have to remember in DMFT index, like a tooth which have several restorations, but it is counted as one tooth. अगर एक टीथ पे अलग अलग रेस्टोरेशन है तो उसको अलग, ऐसा नहीं कि हम अलग अलग उसको फील्ड काउंट करेंगे, उसको हम एक ही फील्ड काउंट करेंगे. So for individual का है यहाँ पे DMF is equal to D plus M plus F is equal to DMF. अच्छा, पॉपुलेशन में हम करेंगे तो टोटल मीन कैसे निकालेंगे? मीन में हमेशा हम प्लस करते हैं, तो टोटल DMF बाय टोटल नंबर ऑफ इंडिविजुअल्स एग्जामिन इन दैट ग्रुप. परसेंटेज अगर निकालना है तो परसेंटेज ऑफ डीके टूथ बाय टोटल नंबर ऑफ डीके टूथ, टोटल नंबर ऑफ एग्जामिन टूथ. अगर डीएमएफ में हमने यहाँ डिकेड मिसिंग फिल तीनों डाल दिया, अगर डिकेड का अलग निकालेंगे तो सिर्फ डीके यहाँ डालेंगे. लॉस्ट का यानी कि मिसिंग का डालेंगे तो सिर्फ यहाँ मिसिंग टीथ डालेंगे. फिल्ड का अगर हमें चेक करना है तो सिर्फ यहाँ पे हम फिल्ड टीथ डालेंगे बाय नंबर ऑफ टीथ एग्जामिन्ड इनटू 100. So WHO modifications of DMFT index. So WHO modifications जो DMFT index का था वो आया था हमारा 1987 में. सो वन थिंग इज हियर इम्पोर्टेंट कि मॉडिफिकेशंस की हमें जरूरत क्या पड़ी. जब हमारे पास पहले से DMFT इंडेक्स था तो व्हाई इट इज इम्पोर्टेंट टू हैव DMFT इंडेक्स मॉडिफिकेशन. तो इस मॉडिफिकेशंस में क्या था कि हम वहाँ पे थर्ड मोलर इंक्लूड नहीं कर रहे थे जो पहले हमारा DMFT इंडेक्स था. यहाँ पे हमने सारे थर्ड मोलर्स को इंक्लूड किए हैं. जो टेम्पररी रेस्टोरेशन है उसको हमने डिकेड कहा है. जो only carious cavities are considered as D. The initial lesion जो chalky spots, stained fissures etc. are not considered as D. जो chalky white spots वगैरह थे उनको भी हमने D के नहीं बोला है यहाँ पे. बट 1997 में वापस से इसको मॉडिफाई किया गया. Until now the missing teeth due to caries are included in M component. WHO 1997 has stated that for individuals older than 30 years, the M component should comprise teeth missing due to caries or for any other reasons. Under year of under 30 years of age, the M component include teeth missing due to caries only. So this is the modifications key point of dental caries. The DMF index was further modified to DMCS CD index. It is equivalent to DMF index and the F component is divided into CS and CD as follows. So जो DMF component था उसमें हमने F को हटा के F की जगह पे CS और CD डाला. तो CS को हमने किया conserve filled and sound teeth, CD को हमने किया conserve but with cavities present on the same or any other surface. Next one is DMFS index. तो DMFS इंडेक्स में एवरीथिंग इज सेम, लाइक डिकेड, मिसिंग, फिल्ड। यहाँ पे टीथ की जगह हम टीथ को एग्जामिन ना करके टीथ के अलग अलग हम सरफेस को एग्जामिन कर रहे हैं। तो सरफेस में भी क्या है कि पहले तो इंस्ट्रूमेंट हम वही प्लेन मिरर और फाइन एक्सप्लोरर यूज कर रहे हैं। Initially, the DMF index was designed for clinical evaluation only. Later, the clinical findings, augmented by radiographs revealing the proximal caries, were included as additional features. Third molars are not included in the index. The maximum number of surface at risk is 128. If third molars are included, maximum number of surface as a risk would be 128. So ये रहा हमारा। इसमें क्या है कि हमने 4 सरफेस लिए हैं। 4 4 4 8 12। ये प्रेमोलर के हमने 5 सरफेस लिए हैं। ये भी प्रेमोलर के 5 सरफेस लिए हैं। मोलर्स के हमने 5 सरफेस लिए हैं और मोलर्स के हमने 5 सरफेस लिए हैं। सेम वैसे ही हमने हर क्वाड्रेंट में किया है। इंटीरियर के 4 लेकर के बाकी जो 4 है उनके 5 सरफेसेस लिए हैं। हर सरफेस पे हमने एग्जामिन किया है। तो डिकेड सरफेस, मिसिंग सरफेस, फिल्ड सरफेस, और जब टोटल हम DMFS स्कोर करेंगे तो DS प्लस MS प्लस FS, तो हमारा वो टोटल DMFS स्कोर आ जाएगा। नेक्स्ट इज DEF इंडेक्स। तो DEF इंडेक्स जैसे मैंने बताया था, जो भी अपर केस में होगा अगर डिकेड, मिसिंग, फिल्ड लिखा हुआ तो परमानेंट के लिए होगा। जो भी लोअर केस में हमारा लिखा हुआ होगा, DEF लिखा होगा या DMFT लिखा होगा, तो वो हमारा प्राइमरी डेंटिशन के लिए होगा। So it was designed for measuring dental caries in primary dentition, and it is given by Grobel in the year 1944. And the criteria for examining DEF decay teeth remained the same as for the DMF index. T is added for teeth, DFT, and S is added for surfaces. DEF stands for D indicates primary teeth that are carious. E हमारा being extracted due to caries, or which are indicated for extraction. So here is the calculation for individual DEF, D plus E plus F. For population, mean DEF, sorry, is equal to total DEF of each children by total number of children examined. And for percentage, total number of decayed by total number of children examined into 100. Now DMFI. In DMFI, everything is same. Decade is for it is given by WHO in the year 1971. इन यहाँ पे हमने डिकेड को वी हैव फिल टीथ विथ केरीज। DF को हमने किया है फिल टीथ विथ सेकेंडरी केरीज। M को हमने किया है मिसिंग टीथ। F को हमने किया है फिल टीथ that shows no signs of secondary caries, and I को हमने किया है filled या unfilled teeth indicated for extraction. So one thing we have to remember that what is secondary caries. So secondary caries is a lesion that forms around a tooth restoration or sealant, and it's also known as recurrent caries. So यहाँ पे जो भी हमारा the DMFI index by subdividing decayed teeth into filled caries teeth D, secondary decayed filled teeth DF, and the decayed but indicated for extraction, that is for I. And secondary caries is also a common reason for dental restoration failures, or especially for resin based material. So this we can understand for secondary caries. Rest everything is same. Now modified DMFT index. So modified DMFT index is given by Joseph Ennis in the year 1983, and the modified the existing DMFT index, improving the criteria, recording criteria, so as to provide an accurate description of the dental care status. The modified version also measured the severity of caries attack, warranting the need for appropriate dental care. In addition to these four categories of decayed teeth, the remaining two categories of DMFT, F field teeth with no decay and M missing teeth, are recorded as usual. The DMF score is the sum of all six categories, and the calculation of the individual component as well as the sum remain the same as the original DMFT index. So this is the procedure, and the modifications involve division of D component into four categories. First is C, unfilled teeth that are carious. In CF, we have restored teeth that are either carious around the margins of the restoration, secondary caries that I have told you earlier, which can reoccur due to failure of previous filling, or primarily on a tooth surface other than the restored one. Next one is IX, which means carious teeth either filled or unfilled that are indicated for extraction. Next, IRC, carious teeth either filled or infilled that are indicated for root canal treatment involving irreversible pulp involvement. In addition to these four categories of decayed tooth, the remaining two categories of DMFT index, F filled teeth with no decay and M missing teeth, are recorded as usual. The DMF score is the sum of all six categories, and the calculation of individual component as well as the sum remain the same as the original DMFT index. Next one is DMFT index. A means ageless DMFT index. So the basic thing is कि here what we can say in simple words, इसको हम primary और permanent दोनों में use कर सकते, that why it is ageless DMFT index. So this is given by Ronir Reggio Lees et al. In the year 2020-22. The DMFT index for individuals aged 12 years and over, the DMFT index for children aged between 2 and 5 years, shares practically the same characteristics, except for the number of teeth in the mouth and obviously the types of teeth and exposure time. Use and interpretation of the DMFT and DMFT indices particularly problematic in situations of mixed dentition, that is in children between 6 and 12 years of age. Comparison of the severity of caries in situation of mixed dentition may be difficult and invalid. So this is about the ageless DMFT index. So the index can be calculated by using any individual who is at least 2 years of old. The reason for the square root of age rather than the age itself is to lessen the impact of this parameter on the index through relativizing its importance in a more appropriate way. So ageless DMFT is equal to DMFT, that is numbers of permanent teeth that are decayed, missing due to caries or filled, plus number of permanent teeth in the mouth or that should be present in the mouth at this age, plus small DMFT, that is indicating primary decayed missing filled teeth who are at least 2 years of age, by number of permanent teeth which is present in the mouth at this age, plus ND, that is number of primary teeth. NP is permanent and ND is primary teeth that are present at this is under root age. So एक जहाँ पे दो तीन चीज रिमेम्बर करने की बात है, पहला तो ए हो गया एजलेस, हम प्राइमरी परमानेंट दोनों में यूज कर रहे हैं, एटलीस्ट 2 years एज होनी चाहिए, और एडवांटेज इसका क्या है? In single index, caries severity can be calculated for individuals of all ages, particularly during mixed dentition period, and can be used to assess caries severity population as a whole. Disadvantage क्या है इसका? It does not take into account the susceptibility of caries according to tooth surface, does not give idea regarding level of restorative care in the populations.